Migraines are more than just bad headaches. They are a neurological condition that causes a variety of symptoms. The most common symptom is a throbbing pain that usually occurs on one side of the head. However, migraine is often accompanied by other debilitating neurological symptoms, including nausea, vomiting, and extreme sensitivity to light and sound. Migraines are often misdiagnosed as sinus headaches or tension headaches. However, the symptoms of a migraine are usually much more severe. They can last for hours or even days, significantly impacting a person's quality of life. While the exact causes of migraines are still being studied, researchers believe that they are caused by abnormal brain activity that affects nerve signals, chemicals, and blood vessels in the brain. Migraines are a common condition, affecting millions of people worldwide. They can occur at any age, but they are most common in people between the ages of 25 and 55. Migraines are 3 times more common in women than in men. While there is no cure for migraines, there are treatments available that can help to prevent them or reduce their severity. Migraines can be triggered by a variety of factors, including stress, lack of sleep, and certain foods. It is important to identify your triggers so that you can avoid them. If you experience migraines, talk to your doctor about the best way to manage your condition. The exact cause of migraines is unknown, but they're thought to be the result of abnormal brain activity temporarily affecting nerve signals, chemicals, and blood vessels in the brain. This unusual brain activity may be caused by changes in the levels of serotonin, a neurotransmitter that helps regulate pain in the nervous system. There are many potential migraine triggers, and what triggers a migraine for one person may not trigger it for another. Some common triggers include stress, anxiety, hormonal changes, caffeine withdrawal, changes in sleep patterns, and sensory stimuli like bright lights, loud noises, and strong smells. Other possible triggers include physical exertion, weather changes, certain foods such as aged cheeses, alcoholic beverages and processed foods, and food additives like MSG and aspartame. Skipping meals or fasting can also be a trigger. It's important to note that not everyone who is exposed to a trigger will develop a migraine. Some people with migraines are more sensitive to certain triggers than others. There are several types of migraines, each with its own unique set of symptoms. The 2 most common types are migraine with aura and migraine without aura. Migraine with aura is characterized by a warning sign, or aura, that typically occurs before the headache begins. The aura is usually visual, but it can also involve other senses, such as smell, touch, or taste. Migraine without aura is the most common type of migraine. It is not preceded by an aura. Other less common types of migraines include chronic migraine, which occurs 15 or more days per month for at least 3 months. Hemiplegic migraine, a rare type that causes temporary weakness or paralysis on one side of the body. Abdominal migraine, which primarily affects children and causes recurrent episodes of abdominal pain, nausea, and vomiting. And vestibular migraine, which causes dizziness or vertigo, often accompanied by headache. Diagnosing migraines can be challenging because there is no specific test. Doctors typically diagnose migraines based on a person's medical history, symptoms, and a physical examination. They may also order imaging tests, such as an MRI, to rule out other conditions. There is no cure for migraines, but a variety of treatments can help to prevent them or reduce their severity. Treatment options include lifestyle changes, such as stress management and regular sleep, over-the-counter pain relievers such as ibuprofen or acetaminophen, triptans, a class of drugs that specifically target migraine headaches, anti-nausea medications, antidepressants, anticonvulsants, nerve blocks, and Botox injections. Migraines can be a debilitating condition, but with proper diagnosis and treatment, most people can live normal, productive lives. If you experience migraines, talk to your doctor about the best